welcome back to the I Ain't Lying podcast. This is Amer Hakim. I have a very special guest today, a guest that is very near and dear to my heart. As many of you guys know, I've been practicing law for over 20 some years, and when I went on my own, it was called Amer S and Associates. I want to introduce you to employee number 3, Ryan Qawasa. Ryan, say hello to the audience.
Hello. Good to be here. Thank you for having me.
Thanks. So Ryan started working for me in 2006. I got a phone call from a fellow attorney, Francis Yono. Francis and I got sworn in together, and I got a call, and he says, "Hey, I got this kid. He wants to be a lawyer. He'd be a great fit for you." I said, "Have him come in." We interviewed him, and he started working in 2006. You started in 2006. Tell us where you were at in your life. How old were you? Were you in school? What were you doing?
Yeah, so at that time I was in high school, junior year. I was looking for a co-op job. So my school had a program where they could, have me get school credit for kind of going and doing something that might serve me in my career in the future. So I thought that'd be a good fit. So I'd go to school during the day, then come work for you, leave school and come to work, and did that Monday through Friday. And yeah, that's kind of how it started.
But it turned into a job.
It did, yeah. So I stayed on, even after I graduated high school, went into undergrad, and then, like spoiler alert, I ended up leaving a little bit before I started med school. But
And I believe you were starting 2006, and then you went to 2012.
2012, yeah.
Yeah, I think I remember that. And what did you do for us?
So at first I started just answering phones, and your brother Summer started teaching me more and more about, kind of doing the paperwork, kind of organizing things, anything that you were offering at the time, doing everything from appearances for traffic tickets to, working on some landlord-tenant documents and business transactions and things like that, starting corporations, tax ID numbers, and just kind of snowballed from there. Just the more I learned, the more I was able to do.
Does any specific case or anything that comes to mind? Because we used to do a lot of stuff back then. You talked
Yeah.
about traffic tickets. You
Yeah.
talked about corporation. We used to do criminal back then.
Criminal, yeah. God, it's been so long. I don't know if I could remember a specific case,
Nothing stands out, huh?
but just yeah, a little bit of everything. You're doing.
We're grinding, weren't we?
No, yeah, it was busy. It was nice. I got to learn a lot. It was a good experience for sure.
What was your takeaway from working at a law firm before you went to medical school?
Yeah, so obviously the things I picked up about the law itself, there's never any wasted knowledge. There's a lot of things that I learned about that, but being that I started working for you at a young age, working in a professional office, dealing with professionals all the time, people I was talking to on the phone, very educated people, some powerful, it's like a little bit intimidating. So I kind of had to grow up from that perspective, and it made me learn how to be articulate, learn how to communicate effectively with people, taking ownership of my responsibilities that I had, being part of a team where it actually had an impact on people's lives, the people you were representing. So that really just kind of carried through and helped me just to be an effective communicator and become an articulate person, starting at a young age. So that was really beneficial.
And people are going to know, how was I as a boss? We're going to go there. They want to know.
Tough but fun, I think, is a good way to.
That was tough.
I mean, you had expectations. If something was, you didn't let anybody drop the ball, which is good. You take care of your people, but it was fun at the same time.
Yeah.
We had a good time as long as things were running and people were doing what they needed to do. It's always fun.
That was back in the day when I'd be at 3 or 4 or 5 courts a day.
Exactly. Yeah.
Sometimes I wouldn't
Yep.
be out of the office most
Yeah.
of the time, but that's great.
Yeah.
What made you transition from the law? Because that was the interest that you had.
It
You
was,
thought you
yeah.
wanted to go into law,
Mhm.
but you transitioned into science, and then obviously eventually becoming a plastic surgeon. So take
Yeah.
me through that transition.
Yeah. So, I mean, it was a long journey, of course, but as I'm in undergrad, right, and I'm taking all the classes that I have to take, a lot of them were science classes. I've always been good at, science, especially biology and that kind of thing. But as the classes got more advanced, I was learning so much more, and I just started getting really interested in thinking like this is what I really want to learn more and more about. And then, from there it's like, okay, what is that going to do for me in my future? How does that transition into a career plan, right? So I started looking into different options, and of course med school was one of them. I started looking into that, started shadowing doctors, started kind of looking into med school requirements, seeing was it a realistic goal for me, those kinds of things. And then, one thing led to another, and that was kind of what I decided on. And I remember being afraid to tell you, because by that point, you had already invested a lot of time in me. I'd learned so much working for you and everything, and it was like it's harder to tell you that than breaking something to like my dad. You know what I mean? Felt like I was gonna let you down somehow, but I still remember how tough it was, like, rehearsing that in my head, how I was gonna tell you, hey, I don't think I'm gonna pursue law anymore, and I think I'm gonna pursue this instead. But
I remember that day was our Christmas party,
yeah,
and I remember we were out and somebody, I think it was Kate Fortune. You remember Kate?
I do remember her. Yeah,
And
yeah,
and Kate said, "Hey, Ryan has something to tell you,"
yeah.
and I think it was her and Jen actually.
Hmm.
And I remember, and I really do remember. I remember Kate had a red drive. It was very vivid in my mind, and I never told you this. There are two thoughts in my head.
Hmm.
First and foremost, I was disappointed because I knew that you were a very motivated and very dedicated and very smart young man. So I was hoping that you come
Appreciate that.
in the stable. But then I was happy for you because I thought you'd be best served doing God's work.
Appreciate that.
I
Yeah.
mean, literally having people's lives in your hands. We figuratively had people's
Yeah, no,
lives in
I
our
think we're all
hand.
doing God's work and helping people, but just different
Yeah.
ways. Yeah.
But I was happy that you found something that was going to make you happy. So I was happy
Yeah.
about that. So you went to Wayne State as your undergrad.
Hmm.
Then you went to Michigan State for your
Med school.
med school.
Hmm.
Did any part of the law in your education or now in practice, did that at all, did any of the knowledge or anything that you learned helped you in your journey? I know you said, which I love that line, there is no wasted knowledge. Like
Absolutely.
you
Yeah.
learn,
Yeah. And
and it
things,
stays, it doesn't go away.
right. Yeah. You never know when something you learn is going to come back and help you. It just makes you a more well-rounded person. So that's why I always say, yeah, there's no wasted knowledge. But again, even just something it might be as simple as somebody like communication skills, transitioning that into talking to patients and, you know, putting things into perspective, helping them understand what's going on with them, and using those communication skills to articulate a treatment plan in a way that they would understand and appreciate. I mean, I really think that I wouldn't have been the same person if I didn't have all that experience starting at a young age. Just having a professional job like that really helped.
Well, I gotta be honest with you. I always knew you'd be an entrepreneur because
Appreciate
while you were working for me, you had your own lawn company. You
it. Yeah.
started cutting the grass at my house.
Yeah.
Your dad's an entrepreneur.
Yeah.
A lot of your family members. So I'm not surprised that you're doing what you're doing and working for yourself. You always had the entrepreneurial spirit.
Yeah. Definitely
So
appreciate
it
that.
doesn't really surprise me. Obviously, you know what we do now. We were primarily a personal injury
Hmm.
law firm. You're a plastic surgeon.
Hmm.
Are there some tips? When should a victim or not a victim, but a client slash patient, when should they consult with a plastic surgeon? What type of injury,
Hmm.
and when is it too early? Is it too late? Can you talk about some traumas that
Hmm.
if someone's been hurt in an auto accident, dog bite, and any type of trauma? When do you think is a good time to consult with a plastic surgeon?
Yeah. I think honestly, as early as possible. So, I think regardless of the type of injury, soft tissue, bony, regardless of where it's at, face, body, extremity, whatever, I think just getting an idea for somebody to help you understand what your situation is, because every situation is going to be unique, and also what options do you have? Is this something that, hey, this would be best served by kind of letting it heal on its own? I think you would do okay. This is what you can expect. Or, hey, we got just in time. Like, this would be a good time to intervene on this and help give you the best chance of healing appropriately. And it's really hard to do that. There's no one size fits all with that, right? So having each one of those patients come in and get evaluated and say, okay, this is what happened to me, and this is what I'm dealing with. Do I have options? What can I expect? Where should I go from here? The earlier you do that, the better. And worst case scenario, hey, it's a little bit too early. Let's see how this goes. Come see me again in whatever X number of months, weeks, days, whatever, and see where we're at. I think as early as possible is good. And there's really not a problem that you shouldn't at least just think about getting evaluated.
One thing that I see in what I do, Ryan, and God bless emergency rooms, they're great. They're seeing many, many different cases. Sometimes the stitches, not the greatest, and that's not their specialty.
Right.
That's not
Yeah,
what
yeah, of
they do.
course.
They're in there, they're working, this and that.
Mm-hmm.
Are there remediation to a bad stitch job that you can help folks with?
Yeah, so I take ER call at a lot of the hospitals I'm at, and I get called in for things like, especially if it's in a cosmetically sensitive area of the face, or especially if it's on the lip or the eyelid or something like that, where you really want somebody who's trained and knows how to deal with those tissues because they're pretty specific and they heal a certain way. But when I'm on call, obviously I go and I fix those things, and I appreciate them calling me to go in and do that. But other times you don't get called, and like you said, there options for revising or something like that if somebody had maybe not an ideal repair at the initial injury. So yeah, there are options. There are sometimes you have to let something heal and then you can revise it later after it's fully healed, or sometimes there are things you could do while it's healing. It really depends on where you catch them and how the thing was repaired and what part of the body it is. And another thing important to consider is, are there going to be any potential functional issues based on where the injury was? For instance, if it's around your eyelid and that scars, and now you have a scar contracture around your eyelid, that can be a big problem. So you really want to make sure you're kind of taking care of that at the right time. So functional issues is a big thing.
So you hit on something interesting. Sometimes you're called into the ERs. Talk to us about the day in life of a plastic surgeon, Ryan. Like what's that look like for you? I'm sure every day is different.
It is, yeah.
Everybody has its challenges, but if somebody's aspiring to be a plastic surgeon, what does a day in the life of Dr. Qawasa look like?
Yeah. So it's pretty unique depending on what you're doing that day. So the OR is the OR. Like I love the fact that you can have 4 or 5 cases in a day, and they could be all very different. You could do a facelift, and you could also have a breast reconstruction. For a breast cancer patient, you could have a tummy tuck and eyelid surgery. You can have literally all these things going on in a given week, right? And then like your office, an office day typically for me. The office day is a full day thing. I usually don't have many days where I'm half day in the office and half day in the OR. Some days it does work out that way, but again, it's just one of those unique things about plastic surgery is that you get such a wide variety of surgical consultations. I might see a follow-up for a dog bite I repaired last week in the ER. The next patient might be there for a tummy tuck or a breast reduction or whatever, and that's pretty much how it works. Typically I like to have either a day in the OR, back-to-back cases, or a day in the clinic. But then you have the unexpected things, like if you're on ER call, you don't know when you're going to get called to come in and do something that you're the one that's most trained to take care of. So that kind of is a little bit more unpredictable, but that's pretty much any call situation.
Sure, and there's a lot of times your consultation days, the days that you're in the office and you're probably giving consultations. I'm going to assume I don't know if you've been watching the news lately. Kris Jenner, she had like this transformation, and we can look and we can talk about that. But could you make me look like Kris Jenner? Was my expectations to talk about patients' expectations and how do you deal with those and with your opinions and tamper their expectations?
Yeah.
Because I couldn't look like Kris Jenner.
Right.
Okay.
Yeah, no, that's a really important question. And it's there's a lot that goes into it. So I'll kind of tell you how I kind of tackle this, right? First and foremost, you have to really make sure you're hearing the patient out and getting a good idea of what's going on with them. What do they feel is their biggest concern? What do they feel is a achievable expectation for them, right? It starts really with reminding it and making sure you acknowledge the fact that every patient's unique, right? Everybody starts from a different starting point, pretty much, you know.
Different baseline.
A different baseline, exactly. Yeah. So everybody's kind of starting from a different baseline and acknowledging that, making sure the patient knows that, hey, there's no one size fits all. Everybody knows somebody who had plastic surgery. Everybody belongs to either a Facebook support group or, they're, social media and things like that kind of shape some people's perceptions of maybe their own body image, or maybe it kind of shapes their perception of what's going on with them. And maybe it's not. Maybe, I don't want to paint with a broad brush, but sometimes that does affect what people come in and how they want to have the conversation, right? And that's okay. Just make sure, for me, it's important to hear them out. And, from there, it's all about patient education, right? One of my favorite things that I get to do in plastic surgery is educating patients and kind of letting them know what I know. And I feel like it's probably similar to what you do, right? You have somebody who comes in and says, this is what I've been through, and I want to sue for $10 billion, right?
Well,
that's a different, you know what I mean?
so, and I really want to interject here.
Yeah.
A question I get all the time,
Yeah.
Amer, can I sue?
Mm-hmm.
The answer is yes,
Right.
you can sue, but that's not the right question.
Right.
Amer, am I going to win if I sue?
Right.
Right?
Right.
So, like, if Peyton came in and said, I want a penis enlargement, then you look at his penis and you say, well, look, it's not going to do you any good. That thing is so small, we're not going to get any bigger, right? You're not going to just give him a penis enlargement, correct? I'm not going to sue just to sue.
Yeah, I don't do penis enlargements, by the way, but but yeah, so a big thing is again,
you should look into penis enlargements. It's not a bad thing, but anyway.
Gotcha. Yeah, might be a market, huh? Patient education, right? Getting them to know what I know as far as, hey, this is what is actually going on with where you're starting from. Here's your baseline, and here's your issue. Sometimes people might think that their issue is worse than it is, and I tell them, hey, it's not. This is what's actually going on. Or some people, the opposite's true, right? And then really having a good collaborative conversation with them about what their expectations are and what is actually realistically achievable. So everything has to be emphasized based on safety too, right? You don't want to do anything. You can be aggressive and try to tackle a lot of problems, and be. You don't want to sacrifice anybody's safety in order to do that, right? You don't want to keep the patient on the table for an excessively long time. You don't want to, be overly aggressive with like how much tissue you're taking or how tight you're making something. It's, again, I'm kind of just speaking very generally, but that's where experience really comes in, and kind of knowing where your limitations are based on every unique patient. Every patient's tissues are different. Every patient has a different history, everything from pregnancies and breastfeeding and hormonal issues, or are they a smoker? Are they diabetic? Do they take steroids to manage a chronic issue? Or, have they had a bunch of weight loss and weight gain? All these things can have an effect on their tissue, their ability to heal. And you really have to take all those things into consideration, and not just keep it to yourself and say, I can't do that for you, or I could do that for you. It's letting them know what you know. And I think that really goes a long way. Once they feel educated, it makes the whole conversation so much easier, and you really can get to common ground that way.
Well, speaking of, patients' expectations, a lot of people go out of the country for these things called medical vacations.
Yeah, medical tourism.
Yeah.
Yeah.
Can you speak about that specifically? Are these things safe? Or, what are your thoughts about that?
Yeah, it's kind of becoming a more common thing, and I would say it's unfortunate, because you're going to hear a lot of the success stories, and I've seen people who have had decent results doing that, but you don't hear a lot about the complications of that, right? So
that's where you see. Right?
Yeah, that's what I see.
You're
right?
coming to clean up, somebody's mess, correct?
It's one way to put it, but yeah, so somebody has a complication. Obviously, you're not going back to your original surgeon to have them manage the complication, right? So they end up in an ER or whatever, or even just your office, and just say, hey, I don't like the way this looks, or there might be a functional issue or whatever. It depends on what they had done. But, and in worst case scenarios, people show up in the ER with really almost life-threatening problems sometimes that you have to kind of be the one to help them through that and revise or get them out of the woods. And then a lot of times it leads to a subpar result. It's the easiest way to do something and get a nice result is to do it right the first time. So yeah, it is a problem. I think people are you know, that everybody probably knows somebody who's done it, or at least can find online somebody who's had a successful outcome with that, but you don't hear a lot about the problems. I think if I were somebody who went out of the country and had a surgery, and probably had some people that might be wanting to talk me out of it or something, and then I come back and I have a complication, I probably wouldn't be the one advertising that, hey, I made a mistake and I went to another country
Right.
and had an issue, right? So there's a selection bias there on the cases that you're seeing. You're probably seeing more of the successful cases, and then you're not seeing as many of the issues.
And really, that's why Peyton doesn't want to come to see you. He went to Turkey to get
Oh, yeah,
vasectomy.
see,
It didn't work out that well for him. So, yeah,
it's all right. Everybody, to each their own, man. It's all right.
I mean, look, it just didn't work out for him. It was
Yeah,
cheaper, but it didn't work out
exactly.
for him.
Yeah.
Another issue that I want to talk about, every time I open up the TV, I got a cosmetic surgeon. What's the difference between a cosmetic surgeon and a plastic surgeon? Can you shed some light about the differences, if there is a difference?
There
I don't
is,
know.
yeah. So, I mean, this is something I feel really passionate about. I see, I could talk about this for hours, honestly, if I had the opportunity to. So,
You don't have
I
hours.
know, I know. Yeah, I won't do that. But, so yeah, all plastic surgeons are cosmetic surgeons as well. That's part of our scope. That's a rigorous part of our training, and it's just a part of what we do. In addition to all the reconstructive procedures and all the other skills that we have to have, right? But
Are all cosmetic surgeons plastic surgeons?
exactly, no. So there are a lot of ways that you can get yourself to become a, cosmetic surgeon. Some people do courses, some people do, you know, so there are some programs that are offered to people of all different specialties. You might do a residency and do a program that teaches you cosmetic surgery, but it's not the same. And here's the difference. So in order for me to get privileges at a hospital, right, for me to be able to do certain procedures, I have to fill out an application that says, hey, these are every single type of procedure that I want to have privileges to do. I have to put a check next to it. I want you to give me privileges to do this procedure in your facility. The hospital, what do they do next, right? They look at my case logs. They look at my background, my training. What is my training in? Any certifications that I have. They look at my references. All these things to make sure that I am safe, I'm qualified, and I'm properly trained to not only do these procedures, but manage any complications that might come up, right? When the difference with doing it in a hospital or doing it, like, let's say I just say I'm going to build out my own OR in my office, or I'm going to go to a private surgical center, which there's nothing wrong with doing those things if you're doing procedures that you're trained to do. But one thing, there's no requirement like, hey, we're not going to let you do this procedure. If it's your own office and you're not getting the insurance involved and it's a cash cosmetic case, there's really nobody to stop you. And I think that's one thing that there isn't patient awareness to that fact, right? That I think the general population, because when I see complications as a result of these things taking place, patients pretty much always say like, hey, I thought if they were doing this procedure, they were allowed to do it, but there's really not somebody telling you you're not allowed to do it if you're doing it in your own office or.
They're licensed.
Yeah.
They're not trained.
Right. So, a lot of times you say, well, they're a board certified physician or they're a board certified surgeon, but board certified in what? And what is their background? What is their training? And do they have privileges at a hospital to manage complications or even to do your case in the first place? Some might say, well, I don't even care to have privileges to do that at the hospital because I don't want to. I'd rather do it at a surgery center. I'd rather do it at my office, which is also fine if it's safe to do so. But the fact that a hospital wouldn't grant you those privileges to do it in the first place if you desired them, that's the red flag, right?
So what questions should people ask before they let somebody, cut them up?
Yeah, that's the question to ask, right? Like what should people be doing, right? So if I could tell patients one thing that they should be doing, it's number one, asking the surgeon, what was your background? What is your training in? What was your residency training in? And what did you do to train to be able to do this procedure, right? So that's number one. Number two is, what hospitals do you have privileges at? If they say I don't have hospital privileges, or I have hospital privileges, but in, a different specialty or different discipline or something, not for this, it's like, okay, well, if I had a complication and I had to go to the hospital, where could you see me to manage my complication? If they don't have an answer for you and say, I could see you for other things, but I wouldn't be able to see you for this, they would have to consult a plastic surgeon to take care of this. Red flag, right? So
Right.
that's And then, we live in an age right now where everybody's doing their homework, everybody's doing their research. They look things up online all the time, right? So if you go and you look up a bio on your doctor and you don't see that they've had dedicated, residency or fellowship training in
Yeah.
plastic surgery, you probably should rethink it.
I started seeing a new doctor, Dr. Chat GPT, and
Yeah,
I get a
yeah, and
lot of questions and
yeah,
answers.
Dr. Google too.
Oh
Dr.
my
Google's
God! Yeah,
a famous guy.
those are my favorite ones.
Hmm.
And when my clients were doing research, I said, "Yeah, that law is good in Minnesota, but we don't do that
Yeah,
here
yeah,
in Michigan." But they're trying to, and it's a tool,
it
but
is.
you got to
No,
guide them in the right
and
place.
yeah, and honestly, I don't think there's nothing wrong with trying to make yourself more informed or kind of getting a little bit more information about what you're dealing with, because a lot of times lack of knowledge or lack of awareness of something just increases anxiety, right? So I get patients all the time, like they've just been given really bad news. They have a breast cancer diagnosis or something like that, and they're trying to relieve their anxiety by getting some information, right?
Yeah.
And there's nothing wrong with that. It's just having somebody that you can kind of tease it all apart and say, okay, well, don't get bogged down with this part. Don't let this part, that you read confuse you or bring you a lot of anxiety. Maybe it doesn't pertain to your specific situation as much. This is what we should be focusing on specifically for you. If it's more of an adjunct to having them, have a little bit more information and they can take their own time and digest it, then it's helpful. When it's harmful is when that's the primary source of information, and you're not seeking an expert to.
When you talk about certifications, I know this because I know you.
Mhm.
You're studying to be board certified, correct?
Yeah, so with plastic surgery, because it's such a rigorous certification standard, right? In order to call yourself a board certified plastic surgeon, what you first have to do is pretty much at the end of your training in plastic surgery, you take your written exam. That's your written boards, right? And that's administered by the American Board of Plastic Surgery. It's a very difficult exam. Once you pass that, then you're quote unquote board eligible. That allows you to be in what we call a board collection period. So your first year in practice, give or take, is like your board collection period. So every case you do is submitted to the board, and they, assuming you get enough cases, they pick from those cases, and you have to give them everything about those cases, and they tear it apart. You have to go in front of them, and they're gonna grill you pretty much. They're also going to be unknown cases. I have no idea what those cases are going to be. They could be as simple as showing me a picture and say, this is what somebody comes to you with, and walk me through it. And you got, I think, like 7 minutes to go through the entire case and hit all the things that they need to hear. And the whole thing about it is, are you safe? Are you a safe surgeon? Can you represent our specialty in a safe way and not, put a stain on our specialty, right? So it's a very important thing that they do. When you have other people who are doing some of these procedures and they don't have to go through that rigorous process to make sure that they're safe to do these procedures, that's kind of where people get into trouble.
Where are you at in that process?
So I'm still in board collection right now. Everything I do is under the microscope. I have to demonstrate that I my thought process is there, that I'm putting patient safety first. I'm not being foolish or overly aggressive or anything like that. I want to prove that I'm worthy of calling myself a board certified plastic surgeon. So, God willing, next November, I'll be taking my oral boards where everything I just explained is kind of going to take place. And,
Nice. We talked about the difference between plastic surgeons and cosmetic surgeons, and
mm-hmm.
I'm not a doctor. I do play one on TV. It seems like a lot of cosmetic guys or gals, there's both, are really business people.
Yeah.
Yeah. What drives them may not necessarily mean, what's the best for the client. What drives them is old white guy named Benjamin Franklin.
Yeah.
You
And I think in some cases that is true. In some sense, right? All of all of medicine is still business, right? You have the insurance companies there. That's still a business. Hospitals have to run like a business and hopefully be profitable so that they can continue serving their community and everything. And doctors too, right? It's no different, but it's more, what is your main priority and what's driving your decision making, right? If your decision making is clouded by I have this extravagant overhead and I have to meet and I have to, just keep pumping out cases and I just have to sign people up for surgery. And that's clouding your judgment and it's making you do things that are a little bit aggressive or unsafe or even outside the scope of what you're trained to do. Or, one thing I always say too is you should never do a procedure that you're not trained or qualified to manage the complications of. Because one thing we say in surgery, any surgical specialty, is even if you do everything right, if you do enough surgery, you're going to have complications no matter what. That's just the nature of medicine, right? So if you're going to have complications and if you're doing enough, you're going to have complications. If you're not qualified or safe enough or trained enough to manage the complications of that procedure, you shouldn't be doing that procedure.
That's why I always tell Peyton there's a reason why you won't do his enlargement. Because
know,
you're not a urologist.
Yeah, there exactly. I'm not a urologist. You have trained people to go to for that.
Ryan, it's that time, man.
Yeah.
It's that time. I ain't lying.
All right.
I ain't lying. And don't come soft either.
Yeah.
No pun intended. You gotta come hard, man.
Yeah.
You gotta come hard.
All right. So, I ain't lying moment. I don't know. Hopefully this isn't too inappropriate, but give my target audience. Yeah, I know. Yeah.
You're all right, man.
So,
You're good.
and on the topic, not that this has anything to do with what he's been joking with you about, but so I just remember in med school, we're all first semester in med school, gross anatomy class. You're learning
Gross anatomy?
Well, it's just what it's called. You have cadaver lab and everything. Yeah, exactly. It can be a little gross sometimes, I guess. But so you're learning from textbooks, and then we go to cadaver lab, and we're all studying all the anatomy. We're seeing in pictures, pretty much illustrations, and seeing it on a real human body. And we're all in our lab coats, and we're all so young, learning to be doctors and everything. And our anatomy professor takes us around to different bodies. There are probably like 12 different cadavers in this lab, right?
What do they look like? What does a cadaver look like? What color are they?
It's-
Is there heads? Are they full bodies?
No, they are. Yeah. No, there's I don't want to get too technical, but everybody, all the bodies are kind of dissected different ways to show you different. Some might be more focused on showing you different layers of muscles and tissues, nerves, and things like
so
that.
there's
Some might be
open
more organs.
skin.
Yeah. One
'Cause
thing
we're
that
donating Peyton's body.
yeah, good for you.
Yeah,
That's it.
after the surgery, we're gonna donate his body. Like he's gonna be a specimen somewhere.
Hopefully not for a long time.
Yeah.
But actually,
MIT already called.
what's that?
MIT, Harvard, they want it.
Yeah, there you go. Yeah,
want it.
high demand.
Yeah, that's it, man.
But yeah, I mean, to answer your question, though, what do they look like? It's not like in the books, right? In the books, everything's a different color, and you feel like, oh, I can easily identify this is red, this is green, this is blue, this whatever. It's not like that in the body. You really have to know your anatomy cold to really be able to identify what you're looking at. But getting back to the I Ain't Lying story is, we get to the segment in our anatomy class where we're learning about, sensitive exams and reproductive organs and things like that, and we're starting to learn about the anatomy of the penis. Not
Fits
not
right
to
in. It's
go
the
back to
theme.
that.
It's
Yeah,
the
exactly.
theme. We gotta get a urologist next time.
Again, hopefully this isn't inappropriate, but it's all educational, right? We're learning about the penis and the anatomy, and it's more complex than you'd think. And so I just remember we're all huddled around this body. We've all got our lab coats on. We all we have our little notebooks and things. And our anatomy professor is talking about the different layers and where's the urethra in the penis and where are these different muscles and where's the dorsal vein and all this stuff. And somebody's just asking a question.
You don't have to show us. We get it, Pete.
Yeah,
We're good, bro. We're good. Thanks. Show and tell time here. I'm sorry.
No,
about that.
thank you.
Yeah.
But so she's, our anatomy professor's trying to answer these questions. It's probably just easier if I show you. So we're standing around this cadaver. She was
going to show you.
Well, not
Oh,
on the
okay.
cadaver, right?
Sure,
But it's she just takes the cadaver and just takes a scalpel and just cuts it and hands it around, and we're just passing around, and she's showing us all the.
No
I ain't
way.
lying, man.
No way.
Yeah. So
She
it's
straight up
and we're
chopped it up?
we're all just we're all young. This is our first semester of med school. We're all just learning, and we're just did she really just do that? But-
That's not the first time she's ever did that.
Probably not. Yeah. But yeah,
Ooh.
I ain't lying, man.
Oh,
That's what
my
happened.
God. No, that's a good one. That's a good
Thought you
one.
would like that one.
Yeah. All right. That's a wrap, man.
All right. Awesome. Thank you.
Oh my god. I was not thinking where that was going.